Nurse Jen on the wards. Do you remember Jen Johnson? She and her friend Joan Capman are both nurses. They work at St. Peter's Hospital, a large teaching hospital in London. Joan did her training at St. Peter's and last year she passed her state finals and qualified. She is an SRN. She is working as staff nurse and in a men's medical ward. Jen is a student nurse and is still training. Last month, she worked in one of the hospital's surgical wards. She learned to set trolleys for sterile procedures such as surgical dressing, intravenous infusion, and catheterization. She carried out certain procedures herself and assisted doctors with others. She often had to go to the central sterile supply department to fetch sterile dressing packs. Sometimes she took patients to the X-ray department or to the occupational therapy unit. This month, Jen is working in the same wards as Joan. She is learning to nurse patients suffering from diseases such as cardiac infarction, cerebral hemorrhage, cerebral thrombosis, and pneumonia. At the moment, she is helping a staff nurse to give injections. The staff nurse is explaining to her the doses, action, and side effects of the drugs they are administering. The other nurses in the ward are carrying out various nursing duties. Some are doing bed baths, one is helping patients to get out of bed, and another is taking CPRS. A doctor is doing a ward round, and physiotherapist is helping a pneumonia patient to do deep breathing exercise. Admissions. In Britain, most people who fall ill are treated at home by their family doctors. Not all illnesses can be treated at home. However, so many people are admitted to hospital at some time during their lives. They are admitted either as arranged admissions or as emergency admissions. Arranged admissions. A patient who goes into hospital as arranged admissions has previously attended an outpatient clinic, to which he has been sent by his family doctor. At the clinic, he is examined, his previous history is taken, and all the necessary investigations are carried out. If admissions is recommended, his name is put on a waiting list, and when a bed in an appropriate ward becomes vacant, he is sent a letter which tells him when to report to the hospital for admissions. With this letter, most hospitals enclose a leaflet telling the patient what he will not need while he is in hospital. The leaflet also outlines the general ward routine and gives details of visiting hours. Emergency admissions. Nowadays, many people go into hospital as a result of accidents or sudden illnesses. These patients are called emergency admissions. They are often seriously ill and in need of immediate care and attention. Unlike arranged admissions, little or nothing is known about emergency admissions or their previous histories. They are usually taken to casualty and emergency department by ambulance. They are often unconscious. Sometimes they are accompanied by friends or relatives who are able to supply at least their personal particulars. In the casualty department, they are examined and the necessary emergency treatment is carried out. If possible, their previous history are taken. The appropriate ward is notified that a patient is being sent up so that the necessary preparations can be made.